Hey everyone, welcome back to Decode Healthcare with Harshal. I am absolutely pumped to have you here for part 3 of our massive deep dive into the musculoskeletal system series. If you've been following along, you know we're breaking down the 20,000 series of the CPT codebook, completely stripping away the confusion and getting straight to the zero fluff facts you actually need to code accurately and confidently. In this explainer, we are focusing entirely on the head.
Alright, quick recap. In part 2, we mastered the really complex world of replantations and grafts. Today, though, we're shifting our focus upward. We're tackling the head section, specifically looking at codes 210110 through 214099. We're going to decode the exact rules for head surgeries, custom jaw prosthetics, and some incredibly complex facial fractures. Look, there are a few major traps in this section that trip up even veteran coders, but by the end of this explainer, you're going to navigate them like an absolute pro.
So here's our roadmap for today. We're hitting TMJ and excisions, head prosthesis, the golden rules of fractures, Lefort classifications, and then wrapping up with what's next. Let's get right into it. Okay, Section 1, TMJ and excisions.
So before we even think about coding a surgery, we've got to understand the real estate, right? Look at the lateral view. In plain, simple English, think of the temporal mandibular joint, or TMJ for short, as the vital hinge connecting your jaw to your skull. It's literally what lets you talk, chew, and yawn. Right below that, you have the mandible, which is just the fancy medical term for your lower jawbone. And above it, you have your facial bones, like the maxilla, which is your upper jaw. Knowing the difference between the lower jaw and the rest of the face is absolutely crucial because the CPT book splits its codes based on this exact anatomy.
Here's the big takeaway. When a surgeon goes in to remove a bone tumor or maybe a cyst in this area, your coding pathway completely splits. If you look at codes 21011 through 21070, you'll see this plain as day. If the surgeon is operating on the mandible, that lower jaw we just talked about, you are routed to one very specific set of codes. But if the excision is on the facial bones, like the upper jaw or the cheekbones, you are routed down a completely different numerical path. You just cannot mix these up, so always double-check the operative report. Ask yourself, is the doctor working on the hinge and the lower jaw or the upper facial bones?
Moving right along to Section 2, custom maxillofacial prosthetics. Okay, so we're moving from removing bone to replacing it. And guys, I need you to literally burn this next CPT guideline into your memory. This is a massive caveat straight from the CPT codebook. These prosthetic codes are used only when the physician or other qualified healthcare professional actually designs and prepares the prosthesis. So what does that actually mean for you? It means you cannot use these codes if the doctor just takes a quick mold and sends it off to an outside lab to be built. Nope. To build these specific codes, the highly specialized surgeon or prosthodontist must physically design and prepare the custom piece themselves.
So what are these exactly? Well, maxillofacial prosthetics are these incredible custom-built artificial body parts for patients who have lost facial structure due to trauma, surgery, or maybe congenital defects. An orbital prosthesis replaces the eye and the surrounding area. An auricular prosthesis is a meticulously designed, highly realistic silicone ear. A palatal lift helps patients who have issues with the roof of their mouth. These are definitely not off-the-shelf items, right? They are highly complex, custom medical works of art, which is exactly why the CPT guidelines are so incredibly strict about who gets to bill for making them.
All right, let's hit Section 3, the golden rule of fractures.
Grab your pen, seriously. Before we even look at specific facial codes, you need the absolute golden rule for fractures straight from the musculoskeletal guidelines. Every coder must memorize this. Closed treatment does not mean the fracture itself is simple. It just means the treatment is closed. The doctor is fixing the bone, maybe by physically pushing it back into place, without ever cutting the skin open. Open treatment, on the other hand, means the site is surgically opened. The surgeon physically cuts through the skin to expose the broken bone to the outside environment, usually so they can screw in titanium plates or nails to hold all the pieces together. If you don't know the difference between open and closed treatment, you simply cannot code this section accurately. It's a real game changer.
Next up, Section 4, Lefort fracture classifications.
Okay, to code these complex fractures, we have to totally demystify these intimidating Lefort classifications. A French surgeon named René Lefort actually mapped out the natural lines of weakness in the human face, and our CPT book uses his exact classifications for surgical repairs. Let's break them down to a 15-year-old level so they stick in your brain forever. A Lefort eye is just a horizontal fracture right above the teeth. Basically, the lower part of the upper jaw is just floating. A Lefort 2 is a pyramidal fracture. Think of a triangle shape starting right at the bridge of the nose and extending down to the corners of the upper jaw. And a Lefort 3? Man, that is severe. That means the entire midface is literally separated from the base of the skull.
So, you might be wondering, why does this matter to us as coders? Well, when a trauma surgeon does a midface reconstruction, the CPT codes explicitly require you to know exactly which Le Fort level they are fixing. For instance, code 21141 specifically states reconstruction midface Le Fort. You simply cannot code complex facial trauma without anchoring these exact fracture lines in your mind. It is all about matching the physical reality of the broken bone to the highly specific terminology in the codebook. Make sense, right?
And finally, Section 5, what's next? Just like that, you've completely decoded the head section. You've got the TMJ down, you know the strict rules for custom prosthetics, the difference between open and closed treatments, and you understand those formidable Le Fort fractures. In Part 4 of Decode Healthcare, we are moving down to the neck and thorax, mastering severe rib fractures and chest wall tumors. Make sure you subscribe so you don't miss it. Until then, I want to leave you with this one thought. Are you relying on the code description alone, or are you actually reading those parenthetical guidelines hiding right above them? Because the difference between a good coder and the great coder is always in the fine print. See you next time.